If you enjoy sports physical therapy and you enjoy working with athletes, but sometimes you feel lost, you feel like you don't know where to go, where to start, and it's a little overwhelming. Well, I'm going to give you a little bit of clarity and direction in this video to help you centralize where to start and how to do that with ease. My name is Dr. Garcia. I'm a leading expert in helping cash-based and sports physical therapists just like yourself improve clinical outcomes and enjoy your craft. Now, when you look at why athletes come to see you, right? They want to be able to play in their sport. They want to be able to continue doing the things that they love, whether that's tennis, pickleball, softball. And you want to see more people like that because you don't want to see the inactive, less motivated individual who doesn't even have goals, doesn't have a desire to be there. They were told by their doctor, and you just want to fill your schedule with more and more athletes to help really understand what you do for them. And the reason why you got into this craft and this profession is because you wanted to help people. Well, helping people requires two people being motivated to do something, and the current people on your schedule, maybe they're orthopedic, maybe don't have that, and so you want to have more of these people. Or you work in a higher level performance center where you see a lot of athletes. In either case, you're probably lost on where to start. The great part is you might have them on your schedule, or you're desiring to have more of them on your schedule. The problem still exists. What do I do for these people? How do I manage them? Where do I start? I understand this because I myself have struggled through this my entire career. I did a sports residency for 1.5 years, and then I worked in professional sports for about 10 years. Now, as a cash pay practice owner, I can easily say that there's an easier way to do this, and I'm going to share that in this video. When you look at why athletes need physical therapy, they don't need necessarily rehab exercises, or they don't need impairments. They don't need a list of things that they do wrong. What they need is clarity and direction on what to do next. And if they want to get to their sport, the first thing that physical therapists do, they go right to, all right, well, let me understand what your impairments are. Let me understand, what you're doing wrong. So you start attacking these random things. You start doing special tests on the shoulder, and then you look at their mechanics with their running, and then you look at their deadlift strength and their squat strength. You look at all these random things, and you're just trying to piecemeal this. You're like, well, I'm just going to get a list of all the problems this person has, and then I'm going to write them down, and then I'm going to give them to them, and hopefully that fixes. So you're taking this like global approach of overwhelming the athlete. And this is probably the worst thing you can do, because these people, as I mentioned, they want clarity and direction, and simplicity is clarity and direction. And you're over here lost in your own head. There's no way that this person who doesn't understand rehab or healthcare is going to make sense of something so complicated. So if your list is 7, 10, 12 things wrong with them, their question is, well, great, what does that mean for me? And so essentially you and your brain have to consolidate all of this information in a single session and being able to deliver that with confidence. And so here's the starting. Here's what you're gonna do. You're gonna take 3 categories. You're just going to look at what they do for fitness in their sport. You're going to look at what they do for a job, and then what they do in their daily activities. All you're going to do is ask them those 3 things. Then you're going to get you're going to get an idea of what their calendar is, what they do for work, how strenuous that is. Then you're going to look at their fitness activities and look at how strenuous that is, and then their ADL. So maybe they work at a bank, they're a teller, and they just sit for a living. Okay, great. So if they don't have static problems like with back pain, it only hurts with, sports. That's less of a factor. The question is, what do they do on a daily basis with their fitness activity and their daily activities? Now, what you're going to do is you're going to look at their total applied stress across time. So you're going to look at, well, they work out 5 days a week. They're walking on a regular basis, and they're very active. And maybe they now are no longer a teller, they work in construction. Right now you have somebody who has a lot of stress at work, a lot of stress in their daily activities, and a lot of stress in their fitness activities. Well, when you apply that to sport, maybe they like playing basketball, and you're working with them because they have back pain playing basketball. You, the physical therapist, zoom in straight into like, well, it's because your hamstrings are tight, and your multifidi aren't working, and you have poor hip hinging. When in reality, if you fix those things, yeah, it's going to help him with basketball and relieving his back pain. But if you understand that he has a construction job with heavy labor, and he sits for a living, or he bends down for a living, or he bends over quite a bit because he has to do strenuous things at work, and he goes to the gym quite a bit, he's overloaded on those things. Why would you give him more stress or more things when you almost need to just back him off? And so in reality, where to start with these athletes is not going straight to their impairments, not straight to all the things, the little things that are going wrong with them. Think about the bigger scenario. What do they do? How much physical stress is being applied across a week? That's the best place to start. So you're going to try and figure out what they do for work and see how strenuous that is across a week. Then you're going to do the same thing for fitness. How often do they work out, the frequency, intensity, and type? And then you're going to do that with daily activities. What do they do? And you're going to sum that up with a total volume of work, and that is then going to influence how how much pain they have. And then you get to look at, well, how much impairments, how much little things here and there are really impacting them. So that's the best place to start. And now the problem with this is that you've been coached by your lead physical therapist, your PT school, and insurance to really go down to the nitty gritty. But when in reality, these people are looking for a long-term solution, and the simplicity of the plan to be able to get there could be as easy as, well, listen, let's back off one day of working out, and then you're going to insert your rehab exercises in that day. So you're going to have 4 days of working out. And at work, you're going to have to be better about your hinging. You're going to be having to maybe change your duty belt, maybe wear it across your sling, or maybe carry it in your arms. Let's take some pressure off of that. And I'm going to give you some hamstring stretches and some multifidi strengthening. I'm going to only give you one multifidi strengthening and one hamstring. So now I've simplified the rehab process, and I've included some things in their daily life. So now I'm getting stress relief across their day, plus target exercises to reduce that. That's an overall global approach. Now, if you're working with pro athletes, you get to control a lot more things. But the problem is, if you go with your insurance orthopedic mindset into working with athletes, it won't work. And that's why you'll get 1 or 2 on your schedule, and then it'll discharge and won't come back. So if you're looking to fill your schedule with, more athletes, get better outcomes, this is the place to start. And if you don't fix this, you're going to have poor results. You're going to have longer recovery. You're going to have people self-discharging. Then you question how good you are at work. You don't love this profession because you can't work with athletes, and you look for another job to help fulfill that. And the problem is that you're just looking at it wrong. So before you go down that rabbit hole, start by doing this. This is an easy solution to help you. So on your clinical notes, put those 3 categories, solve those, and that'll give you some math. And that'll tell you, gosh, there's a lot of stress. Then you look at your impairments, do 1 or 2 things on your impairment-based treatment, and then apply this global approach. That's what athletes are looking for. This is where to start. And after working in pro sports, this is the most fundamental thing that I learned. Start here first, because I can control total volume of work, total intensity. Then I just fine-tune the little things, and that's when their outcomes were fantastic. And the minute that you do this, it simplifies your world, and you're like, gosh, what was I doing the whole time? You were overthinking, overanalyzing, and overcomplicating, and the athlete just wants simplicity. Try this and you'll notice a huge difference on your patient satisfaction, your compliance, and more importantly, your schedule. So I hope that helps, and enjoy that time with more and more athletes. Make it simple, make it easy, and you'll increase their outcomes tenfold. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on treating cash pay patients, becoming that expert in your community, and thriving in business. Thanks, and I'll see you soon.